Ebola is one of the world's most deadliest disease. The virus outbreak killed more than 10,000 people in West Africa since it was officially declared in Guinea on March the 22nd, 2014. The epidemic is the largest in history, affecting multiple countries in West Africa: Liberia, Sierra Leone, and Guinea. The role that photographs and moving images disseminated in the mass media played in shaping the public opinion in the UK, USA, and across the entire globe about the Ebola crisis in the affected countries. What is the public opinion regarding the outbreak after seeing pictures of the outbreak from the mass media? What do people here in the United Kingdom and the United States of America think of the way the crisis has been handled by the mass media?
The media did play a huge role in bringing Ebola to the forefront, but I look at it both ways. I see the media as bringing attention to something that was needed, because prior to the media, it was just deaths. The death rate was growing rapidly. We didn't have the resources. WHO, Samaritan Purse, this is just speaking for Liberia, just could not get enough funding because there wasn't enough information for the world to see what was going on. So yes, because of the media, there was a lot of stigmatization, but the media also helped. It was just like a little fine line that I believe it made a difference had the media not been involved in the process.
The Ebola outbreak affected me in many ways, more than one. It affected me in a way that I never would have imagined. I mean, it was a complete disaster. It was on the media. Everywhere you turn, every radio station, every television station, every newspaper. On top of that, the whole way it was handled in a lot of places, it was quite disappointing. Every time you turn on the TV, it was just this same old Ebola news, and it was Liberia, Sierra Leone, and Guinea in the news constantly. And as a passionate Liberian, it had to get to me. In fact, it was so depressing that I was off sick from work for a period of 2 months. It was very, very, very depressing.
We have suspected case in the city.
I was just sitting at home one day and my cousin called me and told me that, for matter watch Sky News. So I was like, what on Sky News? And she was like, oh, they're showing Liberia, watch Sky News. I'm not going to tell you. Oh, my family back home, they are suffering. They could die.
I was very, very hesitant to go back to work. How am I going to face my colleagues? I've been off for some time. What are they going to be thinking? Have I been to Liberia and back? Have I had contact with someone who has come from Liberia? And I mean, a lot of them were well-meaning, but they can't help but mention.
The disadvantage of, I believe, the media is that Many Africans were being stigmatized. We experienced a huge amount of stigmatization because of what was on the news, because of what was on the radios, because of what was in the newspaper. It was overwhelming to people, and I think there wasn't enough information disseminated about how to prevent yourself from getting Ebola, or even what Ebola was. I think a lot of people were looking at Ebola as that virus that was in the movie Outbreak.
The image, I think people, the Europeans or the Americans or Australians or Asians, people that live outside Africa, you know, some of these people, the image they have on Africans is as if Africans are people who are carrying the virus, Ebola virus. If I'm sitting on the train and then there's a black man next to me, well, there's the chance that he's from either Liberia or from Sierra Leone, from Guinea. So I'd rather sit on the far end, so that I wouldn't actually take my chance to contact the virus through this black man, not knowing this black man is actually he's never been to Liberia, never been to Sierra Leone, never been to Africa for maybe 20 years. So this is the image that some of the people outside Africa, this is some of the image that they do have, and that's all because of the way in which the media has handled the whole situation.
I feel like I cannot tell anybody that I'm from Liberia, and I cannot say anything about Liberia. Sometimes when I'm at work and people are talking about Ebola, I cannot stand up to say, oh yeah, I'm from Liberia, because I don't know how they would treat me or how people would treat me on the streets. So I couldn't be confident to say anything about that I'm from Liberia.
These people are dead. Liberia has the highest among the Ebola population, and the numbers just keep on claiming. It was just keeping rising, going high.
My daughter personally faced a serious issue in school. It was her first day of school. And instead of her being overjoyed, she came home quite disappointed because someone asked her where she was from, and she said she was from Liberia. And simply because she was Liberia, this little girl said to her, "Ew, you have a disease." And obviously this is not from this child's mouth directly. She probably overheard a parent or friends talk about this, and it affects the children.
People weren't really educated about Ebola. People didn't know what it was. The symptoms of Ebola, there was things that were around Liberia for a long time, things like diarrhea and, running nose and little things like that. People had them already. So when the true Ebola cases were being found around, people didn't know what to look out for. Doctors and nurses were afraid, They didn't want to treat people because they didn't know who, how, what. So a lot of people started dying from things like diarrhea and the normal things that kill Liberian people. So if you had like a little illness, went to the hospital, no one would want to look after you because they think you got Ebola. There were hospitals that were abandoned, pharmacies weren't open, shops weren't open, and because people weren't educated about what was going on, they didn't know where to turn. Someone could be in need of emergency, and go to a hospital. They would turn them back because they didn't know what they had. And doctors and nurses weren't trained to actually test people and find out exactly what was going on.
Ebola just emerged in West Africa, and we need that support. So what the media should have done at the time was not to allow the negative impact to bring about discrimination, stigma. Because I remember, like a few weeks ago, I came from France. Because I'm having a Sierra Leonean passport, you can't imagine the humiliation, the amount of checks you go through. But come on, if you look at my passport, you can see I've not been to Sierra Leone for the past 6 to 8 months. So give me a break.
This epidemic could kill hundreds of thousands of people in the coming months.
There was a theory going around. There was this conspiracy that the whole thing was fake. It was made up. Other people say it was it was some sort of weapon that was used against the black race, or it was made to target certain race, which was the black people, and obviously, if that was the truth, that means they succeeded, because the cases of Ebola I've seen with white people. I never saw any white person die from it. They got cured and that. But because we got hit badly, Liberia, like a lot of people, there was a lot of life lost, and the media actually misled a lot of people. And what they were meant to be doing was educating people on how to contain this virus or how to protect themselves. But they didn't do it, in Liberia, there was a state of emergency, kids, there's a huge gap in the education system due to Ebola, because kids didn't go to school for over 5 months, and that's something that's going to affect the Liberian education system for a very long time.
Another role that the media played, was to create awareness, much needed awareness. I know I watched some of the little documentaries that they did on how to prevent Ebola, how people actually catch Ebola, and how we weren't at risk of getting Ebola if we were not around a sick person, and that the people who were most likely to catch Ebola were healthcare workers and family members. And even in West Africa, we had a huge fear of it until we understood the virus, until there were a lot of awareness campaigns and the education that we needed. We got that, and we were able to, I guess, live a little bit more normal of a normal life. It still is difficult. There are countries that are still struggling with ending this virus in their country, Liberia being one of them. But we just really, it takes time, it takes awareness, it takes education. So yes, West Africans and Africans as a whole, we were very stigmatized, but now I believe that it's kind of quieted down since there's barely any news on Ebola anymore. However, Ebola does still exist. This documentary is a way to shine light on the media. I like the documentary because Christabell was able to interview a variety of people who were in Liberia that were affected, people who were not in Liberia that were affected. The Ebola epidemic affected us all. However, we were not all infected, and that's really key. People look at us because we're from West Africa, or from Africa, or that we're black. And it's like they could have Ebola. But we have to understand that Ebola doesn't choose its victim because of skin color, hairstyle, or characteristics. Anyone can get Ebola. So we should all be aware of this situation, and we should all try to fight to end Ebola. We should all work towards assisting in ending this epidemic.
While the media reports help people in Africa in terms of getting international organizations to help, it has not contributed in the image of the continent. So rather than educating the people how to avoid Ebola and how the disease had become so viral, the coverage has merely increased awareness but not tackled the issues. The first Ebola outbreak occurred in 1976 in the Democratic Republic of Congo, yet nothing has been done then. So instead of the media portraying all the West Africans as Ebola victims, they should have gone to their health organizations such as the Central for Disease Control and Prevention, CDC, and asked them why nothing had been done when it first happened. So the media constantly oversimplifying issues. What that does is finding the wrong solution to stop the actual issues.
Stay alive. Stay. Listen to the words of wisdom.